I will now show you how to locate the 8 tibial landmarks that are used for constructing the 5 tibial reference lines. The yellow line shown here is parallel to the sagittal kinematic plane. The poster text explains how to locate the kinematic planes of the knee. First, create a plane parallel to the coronal kinematic plane. Move this plane anteriorly until it's tangent to the tibial tubercle. The point where it's tangent is the most anterior point of the tibial tubercle. At the proximal distal level of this point, you can locate the medial border and lateral borders of the tibial tubercle. You can use these 2 points to calculate the medial third of the tibial tubercle. Now view the tibia in an axial kinematic view. You can locate the medial and lateral borders of the PCL fossa and draw the line that connects them. The midpoint of this line is the center of the PCL fossa landmark. The reference line connecting the medial border of the tibial tubercle with the center of the PCL fossa is located here. The reference line connecting the medial third of the tibial tubercle with the center of the PCL fossa is located here. The reference line connecting the most anterior point of the tibial tubercle with the center of the PCL fossa is located here. The center of each tibial condyle will be calculated as the center of a circle that best fits at least 10 points on the periphery of each condyle. So for the medial tibial condyle, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 points. And the best fit circle that fits these points is here. The center of this circle is here. For the lateral tibial condyle, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And the best fit circle is here. And the center of the circle is located here. The line connecting the center of each tibial condyle is drawn here. The reference line, which is perpendicular to the line connecting the center of each condyle, is drawn here. A resection will be created 10 millimeters distal to the deepest portion of the medial tibial condyle. So here's the deepest portion of the medial tibial condyle, and now we'll resect 10 millimeters distal to that. And here's our resection. And in this resected tibia, you can locate the most posterior point on the medial condyle and the most posterior point on the lateral condyle. You can then draw the line that connects these 2 points. The reference line perpendicular to the line connecting the most posterior point on each tibial condyle is shown here. I will now show you how to locate the 6 femoral landmarks that are used for constructing the 3 femoral reference lines. So hide the tibia and view the femur, and switch to an axial kinematic view of the distal femur. In this view, you can locate the deepest point on the trochlear groove and the center of the intercondylar notch. You can then draw the line that connects these 2 points, which is the reference line parallel to the AP axis of the trochlear groove. In this view, you can also locate the most posterior point of the medial condyle and the most posterior point on the lateral condyle. You can then draw the line that connects these 2 points, which is the posterior condylar axis. You can then locate the reference line perpendicular to a line 3 degrees externally rotated from the posterior condylar axis. Now create a plane parallel to the sagittal kinematic plane. Move this plane medially until it's tangent to the most prominent point on the medial epicondyle. This gives you the most prominent point on the medial epicondyle. You can do the same for the lateral side. Move the plane laterally until it's tangent to the most prominent point on the lateral epicondyle. You then get the most prominent point on the lateral epicondyle landmark. You can then create the line that connects these 2 points, which is called the transepicondylar axis. You can then find the reference line perpendicular to the transepicondylar axis.
The preoperative MRI and the postoperative CT are viewed side by side in the axial projection with the image level of each scan synchronized. The medial and lateral epicondyles are located and connected. This femoral reference line connecting the epicondyles is propagated. This is done on the preoperative MRI and the postoperative CT. The posterior border of the tibia is located and a line tangent to the posterior tibia is drawn. This tibial reference line is propagated and the procedure repeated on the postoperative CT. On the MRI scan, the posterior borders of the medial and lateral femoral condyles are located and connected. A line perpendicular to this posterior condylar line of the femur is drawn. This reference line perpendicular to the posterior condylar line of the femur is parallel to the sagittal kinematic plane and labeled reference line parallel to the sagittal kinematic plane. On the CT scan, the lugs of the femoral component are located and connected. A line perpendicular to this femoral component reference line is drawn. This line perpendicular to the femoral component reference line is the anteroposterior axis of the femoral component. The rotation of the AP axis of the femoral component from the sagittal kinematic plane is computed as the difference of 2 angles. The one angle on the preoperative MRI is formed by the reference line parallel to the sagittal kinematic plane and the femoral reference line. The angle on the postoperative CT is formed by the AP axis of the femoral component and the femoral reference line. On the CT scan, the tibial baseplate or liner is located and a line parallel to its posterior border is drawn. A line perpendicular to this tibial component reference line is drawn. This line perpendicular to the tibial component reference line is the anterior-posterior axis of the tibial component. The rotation of the AP axis of the tibial component from the sagittal kinematic plane is computed as the difference of 2 angles. The one angle on the preoperative MRI is formed by the reference line parallel to the sagittal kinematic plane and the tibial reference line. The angle on the postoperative CT is formed by the AP axis of the tibial component and the tibial reference line.